Do you dread waking up in the morning? Do you hit the snooze button more often than you should? Or do you find yourself yawning uncontrollably mid-morning? If you answer to all or one of these questions is yes, then you probably need a sleep test. Waking up in the morning or remaining alert during the day shouldn't be a hassle, especially if you are getting the correct type of sleep. Sleep is the body's time to reset the brain and rejuvenate the muscles, therefore making it some of the most important hours of your day. According to an article by the Denver Post in 2018, Colorado was named as the second most well-rested state in the country, with 73% of Coloradians clocking in at least 7 hours of sleep per night. That's good news, right? But how many of those Coloradians were actually getting quality sleep? The quality of your sleep determines the kind of day or level of productivity you will have. Poor quality sleep can be caused by several things. But one key thing to note is that through the rise of sleep medicine, we are now aware of the multiple factors involved in the physiology of sleep, circadian biology, and the pathogenesis of sleep disorders. That means it is now possible for us to get to the root cause of your sleep problems or disorders. And the first step is through a sleep study. What is a sleep test? According to Sleep Foundation, a sleep test, also known as a sleep wellness assessment, sleep study, or polysomnography, is a non-invasive overnight exam that allows the doctors to monitor you while you sleep to see what's happening in your brain and your body. We call it a sleep wellness assessment because we understand how big of a role sleep plays in our overall well-being. When we recommend a sleep wellness assessment, our goal is to bring you back to the state of complete wellness, starting with the restoration of quality sleep. A sleep test is basically a chance for your doctor to figure out why you're not getting a full night of restful sleep and address the actual root cause. Naturally, as humans, if something is wrong, we test it out to see where the problem is coming from. The same applies in medical sector. If something doesn't function properly, then we test to see where the problem is. What do you expect from a sleep test? In the past, a sleep test or sleep study required participants to spend the night at a sleep clinic where they would be hooked up to various tubes and machines that measured specific parameters, and they were very expensive. With the advancement of the technology, sleep studies can now be carried out in the comfort of one's home, and all the necessary data can be tracked by your phone. There are various devices that can be used to carry out home sleep studies. Once the results are in, your sleep doctor or your dentist can explain the results to you and what treatment is required. How do you know if you need a sleep test? Breathing during sleep is naturally quiet, calm, relaxed, and almost undetectable. Anything different is an indication of a problem. The most common example of a sleep problem is snoring or sleep apnea, whereby people experience abnormal breathing during sleep. Snoring is caused by the rattling and vibration of the tissue near the airway in the back of the throat, and this makes noise during sleep. Sleep apnea is a multiple extended pause in breathing when asleep. This affects the calm and relaxation needed by the body to acquire deep, restful sleep. Both sleep apnea and snoring are far from the natural, quiet, calm, and relaxed sleep we should be getting. Therefore, making this a clear reason to get a sleep test. What to look for? You need a sleep test if you experience any of the following symptoms. You regularly take more than 30 minutes each night to fall asleep. You regularly wake up several times each night and then have trouble falling back asleep. You often feel sleepy during the day, take frequent naps, or fall asleep at the wrong times during the day. Your bed partner says that when you're asleep, you snore loudly, snort, gasp, make choking sounds, or stop breathing for short periods. Your bed partner notices that your legs and or arms jerk often during sleep, awaking with a dry mouth, morning headaches. What are your next steps? Get it scheduled. Sleep problems disturb your normal sleep patterns and affect your everyday productivity and mood. Long-standing sleep problems can lead to additional health issues and diminish your overall wellness. Every individual has a unique sleep pattern that the body naturally follows. Once there is disturbances or changes to that pattern, the side effects soon follow. It is important to note that there are different causes for different sleep problems, making it hard to know which cause alone is the root cause. Testing and data gathering is required to get a full picture of your sleep pattern and create a customized treatment. Healthcare providers will use your medical history, sleep history, and physical exam to make a diagnosis. Let us be the care provider you need. Get started by scheduling a sleep screening with us today, and you'll be on your way to increase your energy and productivity.